Thank you all for joining us again for another fun, informative, and exciting presentation on behalf of the Office of the President and the Office of Communications and Marketing. I am Dawn Walker, Vice President of Communications and Marketing, and I'm happy to see all these familiar faces and to welcome you all to yet another fun day in the life at Downstate. Welcome to our Women's History Month presentation. It's called Equity at the Table, Women Leaders in Healthcare, Equity, Research, and Education. Brought to you on behalf of the Office of the President and the Office of Communications and Marketing. We're thrilled to have you with us today for what promises to be an inspiring, insightful, and fun conversation. In addition to that, it's going to be action-oriented. We're not only celebrating Women's History Month, but we're also showing who we aspire to be here at Downstate. Our work in healthcare, research, and education demands a commitment to equity in theory and practice, and that begins with elevating those who lead, naturally, mostly women. This conversation matters because while women comprise more than 70% of the global healthcare workforce, they hold just 25% of healthcare leadership roles in the US and Canada. This conversation matters because a little more than 15% of CEOs in health systems are women. This conversation matters because while women of color represent nearly 20% of entry-level healthcare workers, they account for just 5% in C-suite leadership roles. This conversation matters because in research, fewer women serve as principal investigators on large-scale studies, and those who often do receive less funding than their male counterparts. This conversation matters because in academia, women earn most of the doctoral degrees in the health professions, yet continue facing barriers to tenure, leadership, and influence. This conversation matters because these disparities affect careers, policy, innovation, education, and patient care. When women are not at the table, we may get the leftovers after the meal is served. Today's program is more about than just recognizing barriers. It's about celebrating the women who push through them and change the systems behind them. It's about vision, voice, and building a culture allowing women to lead authentically and purposefully. We're proud to host this dialogue and even prouder of the women driving it. It's now my honor to introduce one of SUNY Downstate's strongest leaders and an equally strong healthcare advocate. Dr. Cheryl Ralston is the Chief Nursing Officer for University Hospital at Downstate. She brings a powerful blend of clinical excellence, operational expertise, and heartfelt commitment to her work. She leads with strength and empathy, ensuring that patient care remains grounded in equity, quality, compassion, and that nursing professionals are valued, heard, and supported. Dr. Ralston understands that excellent healthcare leadership must reflect the lived experiences of those who deliver care and those who receive it, and that women must be fully represented at every decision-making level. Dr. Ralston.
Thank you, Dawn. Good morning, everyone. Good morning. I'm pleased to welcome you to today's Women and History Month program, Equity at the Table, Women Leaders in Healthcare, Research, and Education. I'm Cheryl Ralston, Chief Nursing Officer at University Hospital at Downstate. I'm honored to deliver these remarks on behalf of Dr. Patricia Winston, Interim CEO of UHD, and Dr. Wayne J. O'Reilly, President of SUNY Downstate Health Sciences University. This gathering is more than a celebration. It is a powerful affirmation of women's impact on the educational, healthcare, and research landscapes. It is also a call to action for all of us who believe in equitable, inclusive, and transformative leadership. We are incredibly grateful to our panelists and moderators, an exceptional group of leaders, clinicians, educators, and researchers who share their journeys with honesty, wisdom, and strength. Thank you for showing us what's possible when women lead with vision and integrity. At SUNY Downstate, We serve communities that rely on us to deliver care and education rooted in compassion, excellence, and cultural competence. Achieving that mission requires more than representation. It requires equity at every leadership level. And while women comprise most of the healthcare workforce, they remain underrepresented in the highest decision-making roles. Women of color, in particular, face steep barriers that limit opportunity and delay progress. That's why this conversation is so relevant. As Chief Nursing Officer, I've been privileged to work alongside dedicated and remarkable women who lead with grace, grit, and purpose. These are women who improve patient care, inspire learners, push the boundaries of science, and advocate fiercely for their communities. But we also see how systems can limit or overlook that brilliance. And that is precisely what we're here to change. Let today be a catalyst for reflection, connection, and action. Because when women take their rightful place at the table, armed with the resources, respect, and recognition that they have long deserved, the very fabric of institutions is reimagined, rebuilt, and revolutionized. That is the future we are building at Downstate, and I'm proud to be a part of it. Thank you again for being here, and welcome to what promises to be a bold and meaningful discussion. Thank you.
Thank you, Dr. Ralston. So now I get the joy of introducing the moderators. I could go on forever. These are two of my greatest and dearest friends. My absolute privilege to introduce these women who have helped shape the city, its perspective, and in their respective spaces and beyond. They are my sisters in leadership. They're members of my personal board of directors, so when I have a moment, I call and I say, hey, talk me down off that ledge. I know I can call either of them. You should all have a board of directors. Or we jump off the ledge together, right. They've helped shape my leadership journey, and they are phenomenal women empowerment champions. Our decades-long friendship is grounded in shared values, lifting others as we rise, pushing for access where there were once barriers, and mentoring the next generation of women leaders. In fact, under Andrea's leadership, we're all founding members of the Women Cities Network, which is an organization that mentors women in public sector and nonprofit spaces.
And we have over 600 members now.
Yes. Yes.
And we're meeting on a regular basis. And
Yes.
Dawn and Diane helped. We all started it together.
Right. We created this when we were in the Bloomberg Foundation. We were really, really excited to be able to do so under Andrea's leadership. And years later, after the Bloomberg administration at sunset, we are still doing work with Women's City Network. So my friend Diane Billings-Burford, as CEO of Ross Initiative in Sports for Equality, also known as RISE, Diane leads with authenticity and purpose at the intersection of sports and racial equity, working to build more than just spaces, but just and inclusive spaces. In 2009, Mayor Bloomberg named her the city's first chief officer, where she was a force for civic and social change. Diane began her career 2 decades ago as a corporate attorney at Simpson Thacher Bartlett, but quickly realized that her passion was working with those who were less fortunate. She has a BA and JD degrees from Yale University and Columbia University, respectively, and very early on in her career, she interned in the White House. Thank you, Diane. This is Diane Billings-Burford. And for those of you who are Greek lettered organization members, she's a proud Brooklyn native and AKA. Now, Andrea Shapiro Davis is a longtime public servant and policy leader who who currently serves as a senior advisor and director of public service engagement in the Office of the Mayor. She leads efforts to connect top talent in public service institutions with city government. A veteran public servant, she previously served in the Bloomberg administration as executive director of the Mayor's Committee on Appointments, meaning that she found commissioners' roles and board member roles. She also was special advisor for executive searches, helping shape senior leadership across the agencies. In 2012, she became the executive director of what was then known as the New York City Commission on Women's Issues. I hate that word women, those phrase women's issues. It sounds so negative. Yes, we will change that name. Advancing equity in healthcare, economic opportunity, and leadership for women. Andrea also served as interim vice chancellor for the university advancement at CUNY, where she led significant fundraising initiatives and launched impactful programs, including Women in Technology and Entrepreneurship in New York Core, CUNY Cultural Core, and CUNY Arts. She's a former prosecutor in the Queen's DA's office and earned her JD from Hofstra Law School. Diane and Andrea represent the power of purpose-driven leadership and the importance of friendship, mentoring, and collective strength in this work. Please join me in welcoming these two extraordinary women, Andrea Shapiro-Davis and Diane Billings-Burford, to today's Thank you to our panelists, and now I turn it over to you.
Thank you, guys. Thank you so much for having me. And I feel like if there's a place to be recovering, this is it. But that flu took me out last week. So I'm excited to be here. As Dawn mentioned, I still struggle to sit while people are reading my bio, so I'm working on that. I don't like it. I love the bio. I love what God has allowed me to do. I don't like sitting and listening to it. But I will say one of the things that's not in my bio is I am really probably the world's worst conference panel attendee. So it is what I do think is what makes me a good moderator. So I'm going to work to make sure that we have a good time. I mean, we are finished all the fuddy-duddy conversations and speeches for today. Why don't we start with, I'd love to hear from not only the panelists, but the audience. On a scale of 1 to 5, this is 1, 2, 3, 4, 5. How you feeling today? 1 is like me last week. I was 1. 5 is just an amazing day. How we feeling, everybody? Let's see what we got. We got 5s. Okay, we got 4s. You know, listen, girl, we put in secrets in text messages. I think 4 is great. You know. What I done missed over here, we got 5s. All right, I'm loving the 5s. 5s. I'm sorry? You better have a 5. You got 10. Andrea?
I got a 4.
You're a 4?
I'm 4 because I just drove through Brooklyn.
I will tell you
never,
something.
ever do that again.
You're going to stop messing with Brooklyn. This is the borough of champions. You lucky we let you in, okay?
Anybody from Queens? Yes. Me. Hello. Thank you very much.
Whatever. Panelists, I'm going to turn to you all. I would love to, if you could share with folks, we're going to start with intros. If you could give us your name, your title, 1 through 5. Where are you? If you feel like sharing why, that would be great. And then if you could finish with, has being a woman impacted your leadership journey? You know, and I started with has because we have the right to say no. We can say yes to that and we can say no to that. And so seriously, my hope is that we will all be engaged for the remainder of this conversation. And I think there's so much to learn from these women on this panel. So please feel free to share with us. We're going to do intros. You can go in whatever order you would like. I mean, I could tell you because I am good at directing people, but I feel like everyone up here is as well.
I'll go.
That's what I'm talking about, Dr. Oliveira.
I know you're going to pick on me.
I was, but
Is this on?
yes, ma'am.
I don't project very well, so if you can't hear me, let me know. My name is Shushawna DeOliveira. I am Associate Dean for Program Operations and Quality in the School of Health Professions. Thank you, Dawn, and your team for putting this together. I don't think we have this forum too often, or not enough, I should say. Am I forgetting it? Oh, scale of 1 to 5, I'm a 5. I did drive to Brooklyn from Long Island, but I'm a 5. I'm here. I woke up this morning, so I can't complain. Being a woman, I don't want to say it has impacted me. It has definitely created some obstacles and detours. I think there's not enough transparency and support and mentorship.
Hi, everyone. My name is Amal Amar. I am the clinical coordinator and clinical assistant professor for the SOAP Midwifery graduate program. I have about 20 years of experience providing women's health care to underserved communities rooted deeply in midwifery care model. And having so many layers, being a woman and having so many other layers of minority within me, I have so many experiences to share with struggles and successes that I take pride in. And I'm a solid 3 today. I'm fasting. And I had a 2-hour drive from Staten Island. I don't think anyone can beat that. Wow. But I'm here. Wow.
So, hello, my name is Denise Bruno, and I am an associate professor and chair of the Department of Health Policy and Management in the School of Public Health. I'm also a pediatrician by training, and I would have to definitely say that being a woman during the course of my career has definitely created challenges that I don't think others would have experienced. So I'm really grateful to be part of this conversation today and looking forward to ways that we can make the travels easier for those who come after us. And I would say I'm a 5 today.
I guess we're going in order. Good morning, everyone. I am Aimee Afable. I'm an associate professor in community health sciences in the School of Public Health, and I'm an associate dean for community engagement. My passion and my area of research expertise is in understanding health inequities and trying to address sustainable solutions and community asset-based solutions to some of the enduring challenges that we face, including the maternal health crisis, the chronic disease burden that we're all facing locally and globally. The question, I would say I'm number 4. I want to be number 5, but, I guess all of us these days, we're constantly receiving, being bombarded by news that we don't always appreciate and that could in some ways affect our mental health.
Yeah.
And our sort of the hope that we try to hold on to. So yeah, I want to be a 5, but unfortunately reading the news, seeing the news today, puts it a little bit lower. So
Yep. Thank you for that honesty.
Hi, everybody. Good afternoon. My name is Shay Walter. I've been in healthcare for about 15 years, about 8 years in leadership, and about 5 in healthcare quality. I'm the director of quality and performance improvement, and I think being a leader, especially a young female leader, it has absolutely impacted my growth and my journey, and I've had plenty of failures as well as successes. Today I'm a 4 because it's only Tuesday, and and also the subway was very packed this morning. But I'm a 4 because I'm delighted to be here, and I think this is an honor. It's the first time I've ever been invited to something like this, and just sitting amongst these wonderful role models and leaders, I'm excited for our conversation today.
Good morning. I am Dr. Teresa Yvonne Smith-Balil. I am the Associate Dean of Graduate Medical Education and the Interim Chair of the Emergency Department. I've held many roles here at SUNY Downstate in my 14 years of being here, since residency, most of them in medical education, and now taking on a clinical operational role, which has been a challenge. And I will definitely say that throughout all of my journey in my career, being a woman has definitely had an impact. Some of the topics we're going to talk about, so glass cliff. I'm definitely called to be the fixer, having the double binds. But I will also say it's impacted me in a positive way, because I feel like being a woman has made me a transformative leader. And having the perspective that's more humanistic oftentimes and reminding us of what we're all doing here, which is to provide care for our patients. So I feel like having the perspective of a woman brings a little bit of estrogen in the room where it's well needed. And since Dawn gave us the pleasure of telling us your sorority, I will just say that I'm a member of Delta Sigma Theta Sorority Incorporated. And I'm a 3 because I too am also getting over the plague.
All right, hello everyone. I'm Marlene Camacho-Rivera. I am an assistant professor in the Department of Community Health Sciences here in the School of Public Health. Like all of these amazing women sitting next to me, I also have an administrative leadership role. I serve as the Assistant Dean for Student Affairs in the School of Public Health. I am a social epidemiologist and health equity researcher by training and practice, and so these are tough times that we're living in today, but I'm gonna say that I'm a 5 because I'm moving forward with clarity and purpose and intentionality, and I will not let anyone take that away from me. And I will say that being a woman, specifically a young Latina woman, is at the core of everything that I do with respect to my research and my education and my service. And so it has impacted me and my leadership style and what I bring to the table pretty much in every aspect.
Thank you guys so much. Thank you.
So I just want to say a few things. So first of all, I believe that I am, if not one of, the oldest person in the room. So for me, we were talking about glass ceilings. I'm 65 and I'm proud of it. Okay? So and also what Dawn left out is probably the most important thing for me, and that is I have twin boys who are 30 and 4 grandchildren, one of whom was born 1 month ago at KCH. So I love being out here, and I'm getting to a 4.5. I'm recovering from driving through Brooklyn. But I was going to say, in terms of this glass ceiling, because we're going to go to Glass Cliff, when I was coming up, there were not a lot of women who were lawyers at the time. I'm a recovering lawyer now. I don't practice. But it was difficult back then. And a quick story is that when I went to work at a law firm, I interviewed with long hair, and the first day I cut my hair short just because I wanted to. And one of the managing partners said, "You look so much sexier in long hair. Why did you cut your hair?" And over the next few years, the man took a ruler to my skirt to measure how short it should be, chased me around with a scissor trying to cut my skirt, talked about having an orgy, popped my bra in the office, and it culminated with him pouring a coffee pot of water over my head and talking about having a wet T-shirt contest. That was 40 years ago. And it took me years to come forward. My colleagues wouldn't talk to the person. I mean, maybe it sounds funny now, but back then, it was serious. And so it is so great to see the change that has come about in all those years. So as a senior citizen, I get to say all that. Okay, now, let's go to the glass cliff. The glass cliff is a term used to describe a phenomenon where women, and sometimes other minority groups, are more likely to be appointed to leadership positions during times of crisis, turmoil, or high risk. Okay, given that women make up over 70% of the healthcare workforce, but only 25% of the leadership roles, have you guys observed the glass cliff phenomenon in your career? And what structural changes can institutions like SUNY Downstate implement to support women in high-risk leadership roles and ensure their long-term success? Anybody want to take a shot at that one? Or not?
I can start. So before coming to Downstate, I was a nurse manager for many years. I worked 6 years in Dallas, Texas, and 3 years in Colorado, and let me tell you, it was much less diverse than here, so I'm very happy to be here, where there's some flavor and some excitement. But and when I became a leader, I was first almost told to become a leader. I was a charge nurse that was an assistant manager, and I was made to be manager, and I was 26 years old, and I was not ready. And I came in and I did an excellent job and I cleaned up the unit. And then as soon as I did that, they said, okay, well, we're going to give you another unit. That manager left. So I ended up switching jobs, and it was another unit that was in complete disarray. I ended up cleaning up that unit. Granted, I was a young leader. I thought it was normal at the time. but it wasn't. It was not. I was put in a situation where there wasn't structural, incentives. There was not. They just kept giving me more work essentially, and I think that happens to women all the time. I think women are used to juggling children, elderly parents, and tons of things outside of the office. So often in the workplace, they're often given too much than they can handle, and they're set up for failure and not success. So some things I think that we can institute and that have really helped me through my career is, the biggest one is mentorship. And not only seeking out a mentor, but after you become a leader, you should become a mentor to others. Many women face imposter syndrome, and they feel like they're not ready for a role or they don't deserve to be a leader. So one of the things I take great pride in is seeing leadership qualities in young nurses and young leaders and really building them up. And like you all mentioned, I think we need to have networking. I mean, just this event today is amazing. Imagine if we did more of that. As well as making leadership positions available, making room at the top, and then also, calling out gender inequalities and gender bias and looking at the problem right in the face and not tucking it away. Thank you.
Thank you very much. Anybody else? Go ahead, please.
So prior to my shift to academia, about 3 years ago, I was part of NYU Brooklyn, Langone, and I was part of the midwifery program over there. And our midwifery director had abruptly moved on to another opportunity.
I'm sorry, is your mic on? It's hard to hear.
Should I start over?
Okay.
Okay, so in my prior job at NYU Langone, Brooklyn, I was a midwife, a full scope practicing midwife, and our midwifery director had abruptly left to another opportunity. And I had taken on being the most senior midwife in practice at the time. I took the onus to, prepare the new oncoming midwives and orient them and, take on the tasks of that midwifery director. And as a result, I was promoted into midwifery director, but speaking of the phenomenon of the glass cliff, I had no preparation, no mentorship, and I had to do a lot of self-advocacy and navigate my way through that role and try to optimize my success and my team's success with a lot of just self-advocacy and trying to root for me and my team. It was difficult and challenging, but I found the beauty of that and the success that turned about afterwards. And after that, I decided that, through the precepting that I was doing to midwifery students, that I would always introduce the concept of leadership and confidence and believing in yourself and creating the change, the transformative change that you had spoken of earlier has become sort of my professional story.
I'll add to what Amal shared and what you shared earlier. I'm probably going to date myself. I dated it actually when I was chatting with Teresa coming in. I'm like, did you do your residency here in 1989? She said I was in, what, 6th grade? It's like, oh,
Yeah.
So I've been at Downstate for 36 years. I grew up here. And I think leadership is a lot like parenting, right? I think it's something that came natural to me. After earning my doctorate degree, it was time to shift into another role within the institution. And those of you who know me, know my story, will know what office I'm about to chat about. I stepped into an area that had a high turnover of directors. And it was an area of turmoil. There was a distrust for leadership, lack of resources. So it's almost as if we walk into an area expected to fail. And I got forewarned by program directors, which was my previous role, to say, are you sure? Because if you go, you may end up losing your job. And I think as a leader, as long as you stay true to who you are and know what you're able to achieve, because for me, failure was not an option. So even if that was the expectation, it wasn't going to happen. So one of the things that I did to help me navigate the cliff was to meet with the staff individually, learn and understand through their lens what they're dealing with in the area. I also met with stakeholders that my role had to interact with and the role that the office had to interact with, which helped a lot because it created transparencies. Had lots of meetings, had to make lots of difficult decisions. But I think in having those alliances and through transparency, I was able to foster change. So I think that goes a long way. In terms of what we could do, and I think we as in Downstate, appreciate forums like this. Part of me says just talk. What are we gonna do from here on in, right? Are we gonna build mentorship programs? What do they look like? Are these mentors that truly want to mentor other women? And mentors could be males as well. Certainly my mentors have been 2 males here at Downstate and 1 female in my 35 years, Dr. Lewis being one of them, right? You need a supportive person, and I'm embarrassing him because he does that to me all the time. He has been a driving force to push me out of my comfort zone, this being one of them. But I think we could be transparent in terms of what promotion criteria look like for women. Not use the same faces all the time for events. There are leaders at different levels throughout the institution. I think it's important to highlight each and every one of them throughout the year and not just in the month of March. And I may be pushing the envelope here, but pay equity for women, Black and white.
I'll just add just one more comment to that. You know, I think the problem is that it's a cliff, right? In all the stories that you all told, and including my own career, we did well with the challenges. Women do well with the challenges. We do clean up. We get into a disaster and we fix it. We'll continue to do those challenges, right? It's not the problem of what we're trying to say to our colleagues, our bosses. We are proud to be the fixers. What we do not want to do is, 1, don't expect us to fail, and 2, give us resources. Do not expect magic. You know, expecting magic tricks with our hands tied behind our back is impossible. And so that's what we need. Yes, we'll take on the challenge of going up that mountain to fix it, but we need resources. Put us in a situation that's gonna be resources. And then value us in that role, saying we put you in this role because we know you're qualified. We know that you can fix it. And with that should come the pay to let us know. Like you almost were shy about saying it, right?
Talk about it.
Like a little bit shy about, you shouldn't be shy. It's a problem. It's a problem here, it's a problem everywhere. We shouldn't just be put into roles to say, well, you should be happy that you're the first woman in this role. And so the pay is not gonna be great, but guess what? You're the first woman in this role. No, that's not how it should go. It should be, we value you for your skill set and your level, and we're gonna pay you accordingly.
Excellent.
I agree with you more. Yeah.
And maybe the institution should be happy that you are in the role, right? Instead of us being happy to be there. I love it. Thank you all for sharing. And Dr. Smith, you had mentioned the glass cliff earlier, so I was getting ready to call you out. I thought maybe you weren't going to answer that question. So we all know, and it's been interesting listening to you all, that women face a double standard, right? I think in many instances. I'm a mom of 2, and I used to tell my kids I'm from Brooklyn, I'm new wave. I'm new wave. I learned, I went to Ivy League schools, but mommy only has so many tools in her toolbox. Hi, Anika. I am running out of tools, and the only one left is a hammer. So it's up to you if you want me to bring out the hammer, right? And I feel like as women in many roles, when we decide we're about to bring out the hammer, right? I'm about to just bring all my force. I'm gonna win. I love that you said, everyone said this was not gonna work, and you were like, but failure was not an option. Sometimes when we come like that, right, we deal with this double standard of we are not acting in feminine ways, right? We're not necessarily called strong. We're not called assertive. Folks use other words. And so I would love for folks to share, have you experienced that double standard in any particular instance? And more, clearly folks need to stop doing it, but I think it would be helpful if you could talk through how did you manage when you were in that instance, you were held to a double standard. What did you do in that instance? And I do have folks I could call on, but really, I'm gonna let y'all go first. You don't have to look scared, Dr. Oliveira.
That
I
hammer's
know.
coming down, so somebody should.
Dr. Bruno?
Sure. I can say that at different points in my career, it was very clear. It was very clear that the expectation for me may have been different for someone who was not female. And in these different roles, if you come on too strong, to your point, you're not really, you're being aggressive, you're being, unladylike or unprofessional. And then if you stay in the background, you don't have the strength, you don't have the character, you don't have what it takes to be the leader in that role. And I found over the course of many different positions is I needed to always be extra prepared. I need to know things, I need to be more prepared than the next person. And I also stopped waiting to say my point, because I think I always tend to wait and listen before I say my point. And sometimes when you stay in the background, people assume you don't really know, and it's better to find that middle ground and make sure that you're heard. So be over-prepared and make sure that you get heard. And I think that makes a big difference.
Yeah, I wanted to build on that point about balancing between being conceived or perceived as too assertive versus too quiet. I do think there's a role of being strategic when you speak up, because I do see, especially for women who speak up too much, their credibility is affected by it, right? So not that they shouldn't be speaking up. I mean, I will contextualize this. We are at Downstate. We are working in an institution that has low resources in general, and we work in a system of constraints right now. And so it's hard not to speak up all the time. And I think that in some circles, or I'm still navigating that, I'm trying to figure out, what is the best strategy to articulate really the issues so that we can build a stronger system. And so I don't think that's easy. I'll make that point.
No, it's certainly not.
I'll just say that I think instead of putting it on us, I think it's called double bind, right? So when women have characteristic leadership skills which are deemed gendered male, being assertive, they're saying that they're aggressive, right? Not assertive. Or if they have characteristic leadership skills that are deemed female, they're nurturing, they're compassionate, then they're a weak leader. And so I will challenge my colleagues here to say that it's not us that needs to fix it, it's them. It's their problem, not our problem. So, I've been accused of being assertive, aggressive, and every other B word you can think of. Personally don't care, right? Because that's their problem. Because I'm demonstrating leadership skills that if my colleague were male, they would say, that's a strong leader. That's a leader that we need to follow. And so for me, the system needs to fix themselves, not us. If you need to speak up on an issue, you speak up. If you need to speak up again, you speak up again. Because that's your leadership. And for us to shy away because we want to be in this middle ground so that people don't perceive us as being too aggressive, then we're always going to be pushed into a corner to never be able to speak up. And so that's the double bind, and we need to fix the double bind.
To your point, I noticed that there were quite a few men in the audience. And in order to bring about change for women, you need to include men in the discussion, right? So I hope that the gentlemen here are listening and taking note. And maybe one of the actions after this is to have a meeting and talk about real issues and where you go from here. I think you use this, and a lot of people have mentioned this about, this is a beginning, right? This is a first of hopefully many. This is a beginning of mentorship and networking opportunities, and it's a beginning of conversations with others. Where do you go from here? There should be action items at the end, right? So that this isn't just a one-off, but it's start of a process that's going to bring about hopefully change. And I agree with your point about, so many times I've been told I'm, whatever words they use. A deputy mayor once told me I was mean because I was asking a bunch of questions to somebody. If I were a man, certainly wouldn't have called me mean, and I would have said back to him what I really thought. In the Obama administration, they had this.
I'm a woman and I say it back. What I
See,
really
that's
think.
the difference. So I was listening to you about the hammer and thinking that was the mistake in raising my kids. Diane, I want to be more like Diane.
No.
Diane, and I do think it's partly where we come from and the age difference that, when I ask a question in a meeting with lots of men, I typically do, well, maybe we could do, or what do you think about this? Or I don't go out there and say, I think this is a good idea. What do you think? That's generational. That's on me. You shouldn't do that, right?
I think it's also cultural, right? Our cultural upbringing. I'm reminded of when I interviewed for that position where I had to fix the area, where the mentor was concerned about how I was going to interview. 'Cause, I have no filter, and the concern was how honest and transparent I was going to be in that interview process with the individuals that I was interviewing with, because I had some I thought were positive interactions, but it wasn't received that way. But I say that to say, I think as a leader, it's important, to Teresa's point, to stay true to who you are. If you got something to say it, right? Dawn, in fact, turned me on to a book which I started to read, part of me not being no filter. It's The Subtle Art of Not Giving an F.
Not giving a what?
And another colleague of mine, Ms. Alvarez, I'll point her out, who turned me on to a book by Mel Robbins, The Theory of Let Them. Basically, you can't own what others are thinking and what they do. You're only in control of you and your actions and how you decide to move forward. And I think those two books have similarities, and I'm not a reader by no stretch of the imagination. But those two books resonates with me, and it's something that I have often practiced without being aware of those two books. Yeah.
Maybe you want to share those books with your colleagues, right? Maybe there's a way to share research.
I have.
Okay, then. Okay. Well, I think that's a good idea. Go ahead, yes.
I have another point to add. Reflecting on my prior role, I feel like, when my program was in jeopardy, I was asked to, you do you, you go. There was confidence and a belief in me to, deliver and train and, lift the program up. When it was time for, participating in policy making and, and change, there was limitation. With mid-level management, there's always limitation. Which speaks to the low percentage of presence of women in executive and senior management. I felt very uncomfortable when I was at a stage where I needed to participate in policy making and advocate for my team. And I was given a piece of advice that I really took to heart, and I acted upon it. If you do not feel welcome and you're not celebrated the way you are, find a platform and a place where you are celebrated and heard and advised to be your best self the way you are and not transform into someone else that's appeasing to your the management that you work with.
I think you're spot on. I'll stop talking in a minute, Diane. But to your point, the reason we started the Women's City Network back in like the 2010 or something was because partly I didn't have a network coming up. I'm the first college grad in my family. And I wanted to bring our friends together. And I wanted to share what we knew with others so that we could help others, right? It's all about bringing other people up, building that bench, and building the leadership roles here, right? With more women in power, we will hear each other. So developing a network here and getting to know others more and having meetings and bringing in speakers or authors could really inspire others here, I think, maybe. Yes? No?
I want to add something to that because I have reached out to others for help or for mentorship or to collaborate. And women, Black women, through my experience, have not been supportive, meaning that they are more concerned about their shine and elevating themselves as opposed to collaborating to help both of us shine, right? And I had a colleague recently who reached out for help and got the buy-in to do the help, but when it was time to actually do the work, they were MIA, right? So it's mentorship and collaborating is one thing, but you have to not just mentor and collaborate with those in senior leadership. How do we help others on the lower end to come up, right? We have to create a safe space for people to come to be able to have those conversations or feel included in that conversation or feel like they can achieve those things. And I think that's a huge gap here.
I think we have to support each other. So in the Obama administration, when women were in a meeting, if someone brought up an idea, the other woman in the room would raise it up so that at least it had some support so that the idea would get discussed.
Yeah.
Supporting each other, I think, really works. Diane?
It does. I'd like to, I happen to know a little bit from reading some of you all's bios that you actually have been involved in building mentorship opportunities. And so I would love if you could share, because we're hearing some of what is ineffective, right? But what are some of the, you referenced this wonderful ally right here, a man who is a wonderful mentor of yours. What makes an effective mentor? What makes an effective mentorship opportunity in you all's field? I feel like I could answer that as a lawyer. I could answer it as a not-for-profit leader, but I couldn't answer it in the medical field. So I'd love to hear that answer. And I know some of you have built those programs and done that.
Yeah, I guess I can.
I was
speak a little
staring
bit-
at you.
Yes.
Camacho, thank you.
I mean, I can speak a little bit to it from the academic standpoint, and I think from a research standpoint, I think there's a few strategies, and I'm a social epidemiologist, so I think in layers and levels. So maybe I'll start at the individual for strategies and work my way out. Individually, I think it's recognizing that one person is never going to meet all of your needs as a mentor. And so having a team, Dawn was mentioning that board of directors who's really going to be able to provide you with the different types of mentorship that you need. And so I have research mentors who are, in specific areas of expertise that I can come into. I have, a professional mentor that serves more in the role of an academic advisor when these types of leadership opportunities or other opportunities arise, someone that can really help you, weigh the pros and cons and make those types of decisions. I have a personal mentor who helps me with balancing all of the other things, because I'm not just an academic, I'm not just a researcher, I'm a caregiver, I'm a mother, I'm a spouse, I'm a member of a community. And so how to balance all of those different responsibilities and dynamics as well. And so from an individual standpoint, I think recognizing that one person is never going to fulfill all of those needs. And so having a mentorship team, I think, is going to be really important, recognizing that mentorship is bidirectional. And so you need to put in order to receive. And so making sure that, as an individual, you also have the time and the commitment and are clear about what you're looking for and what you bring to that relationship. Oftentimes it's not just needs, but we have assets and strengths that we bring to those relationships as well. So recognizing as an individual, I have something to offer. I think, and then from an organizational level or from a systems level, really recognizing that it takes time and it takes resources to do mentorship well. And so there's, specific trainings that you could look into for people to be able to mentor, especially when you're mentoring across different social identities and mentoring across different social groups. So finding ways to make sure that your mentorship is inclusive, to make sure that mentorship is equitable. And so as an institution, if mentorship and advancement is something that we want to value, recognizing that it requires resources, time, money, other types of commitments. And then I think from a policy standpoint, recognizing that, it's great for all of us to sit and have those connections, but how do we collectively advocate for policy change that is going to benefit not just us in the short term, but future generations to come? So to make sure that we are moving just beyond what we're receiving individually or within these interpersonal relationships and moving our mentorship towards some sort of collective action.
I think the minute you start to say include resources, things tend not to get off the ground, right? I believe mentoring can be informal, right? If you, within your department. I'm sorry, Alan, but when I got to SOAP, when I got to the School of Health Professions, we had many conversations about my trajectory, what I want to do. I pinpointed my areas of weakness, and there's not one day where he discourages me, right? He's not being paid to do it. He doesn't have to do it. He could just let me do my job, right? I think having those informal mentorship within your own area, it goes a long way. It doesn't cost money. All it takes is for someone to set aside 30 minutes, an hour, whatever. You could do it over lunch. To have that conversation with your staff person or your faculty member to get at, what are their hopes and dreams or aspirations in that role. So I don't think it should be associated with resources. Not to say that I disagree with you to a certain extent, Marlene, but I just want to make sure that we don't attribute monies to it, because if we're going to continue this conversation and you tie resources to it, then we tend not to expand on it.
Right. I think you're straight on. And sir, Alan? Yeah. But your formal name is Mr. Dr.
Alan.
Dr. Alan Lewis.
Sir, you've been called out here a few times. I was going to pull out, do you have
He's
suggestions?
sitting in front. I told him to sit in the back.
I'm sorry to embarrass you, but Diane was talking about having this as a conversation, and I was just curious if you had any suggestions, ideas as we talk about these issues. Is there something you recommend to your colleagues, to others, to help support the women here? And then we'll wrap up because we have 10 minutes left.
Certainly, I hesitate to speak because this is not the time for my voice. This forum is not the time for my voice, but since you asked, and I do talk a lot. I'm Dean of the School of Health Professions here at SUNY Downstate. Most people in the room probably know me. Speaking on, and Shushawna, shame on you. Pointing me out, don't celebrate me, it's women's time. But anyway, in terms of mentorship, there are a couple of things. First of all, Marlene, I love what you said about being an epidemiologist and the levels of influence. I'm not a public health professional, but I do know about the socioecological model by McLeroy, Bibbo, Steckler, and Glantz that talks about interventions at 5 levels: individual, interpersonal, organizational, community, and policy. That's one thing. Mentorship should have strategies at those 5 levels. But in terms of my own mentorship approach, I'm a parent too, adult kids, and I don't want to confound. I mean, being a mentor is not exactly like being a parent, but anybody I've ever mentored in my career, 40-some years, I've always said my goal for you as a mentee is to surpass me in whatever I'm mentoring you in. I don't think many mentors embrace that approach because a lot of mentors still want to be the person, and their ego is tied up in it. And my thing is, if I'm mentoring you in research, teaching, or whatever it is, the goal is for you to surpass me because you are the future, and you got to know more than I know. You got to have better credentials than I have. You got to have a better CV than I have. So if I've not enabled you to surpass my accomplishments in the mentor-mentee relationship, I failed. So that's a real tall order, but that's how I approach it, to equip my mentees to be able to surpass anything I've ever done, because that's the goal. They're the next generation. They've got to be better equipped because the world gets more complex as we go forward.
So since we're in a healthcare institution and potentially research, maybe we could clone you, learn how to clone you. That's very helpful. Thank you. So we have 7 minutes left. So Diane, where do you want to take it from here?
I think I want to, what we haven't talked about yet, and we're going to jump. Thank you so much for that. And I'm sorry I was giving you the wrong direction. I thought someone behind you wanted the mic. I'd like to talk about equity in research in education. I feel like that's something we just haven't spoken of, and since time is winding down, I think we should just jump to it. Look, see, you ready? Oh, I just love this team. This panel is ready.
Well, I want, oh, sorry.
Yes, you can do whatever you want.
I wanted to build on what Shushawna was saying because, yes, we don't have resources, but I think a low-hanging fruit here is that we can protect faculty's time for research and mentorship. And that takes, it takes a recognition that maybe, they're overburdened or their workload in one area does not afford them the time to be able to properly mentor. And then that mentorship, but again, the one-on-one as well as group mentorship. And, again, I'm going to focus to Dean Allen. He sponsors research capacity.
I was going to counter you with that, by the way.
Yeah, but that's that's the thing. But, I'm just learning about it, and I don't know why it's not, I don't know how much School of Public Health is engaged, but there's so many opportunities to share our work, and we don't do it, like internally. And we need to protect time to do that, or at least disseminate those opportunities. Because again, I didn't know about that research capacity building seminar series at all until Danby brought it up. So I think, it doesn't require too many resources, but it has to, leadership or, the groups that are assessing our qualifications for promotion and tenure have to recognize that, we have to create time for that and give value to that as well. So.
Thank you for that.
So I want to acknowledge that, oftentimes we fall into this fallacy of scarcity where things have to be an either or and not a both and. So this can be a both and conversation where informal mentorship, low-cost strategies and resources are incredibly important. Those are things that we can implement today. And I will say Downstate is probably excellent in that capacity and doing those things well because we have amazing, dedicated, talented, researchers, educators, practitioners who are doing that. But that should not stop us from advocating for more because we do deserve more. And imagine how much more we could be doing, for example, through research if we were going after training grants, center grants, other types of resources to be able to help leverage and sustain some of those. So I just want to be mindful that we don't necessarily always have to jump into either ors. We can have that both and conversation, while we're doing the work. I think with respect to research and equity in research, I think, what Aimee has mentioned is spot on. I think that there's no shortage of talented researchers, who are women. I think what we also know and the evidence, very clearly documents and suggests is that women take on much more additional areas outside of research that are less visible, that are less rewarded, that do not necessarily align with the policies around tenure and promotion. We know this. This is very robust literature that talks about extra service committees, extracurricular activities outside of, the institution, teaching loads. We also know, we talked a little bit about salary equity, but if you're going to talk about research, you need to talk about institutional inequities with startup and research support and administrative support. All of those things, put people at different playing fields when they're thinking about how they can generate preliminary data, have support to be able to develop investigative teams, and also, to be competitive for specific grants. And so I think beyond salary equity, we need to talk about, yes, institutional inequities with teaching and service, also institutional inequities with respect to the supports that come with being able to do the research. And then also just thinking about who's speaking the name of these phenomenal women researchers when these opportunities arise. Oftentimes as a researcher, you don't jump into your first grant being a PI of a major R01 level, which is like the gold standard, maybe not anymore, but the gold standard for being an independent scientist. But oftentimes in research, money gets money. It takes money to make the money. And so you have to be a co-investigator. And then from a co-investigator, you build up your reputation and your expertise in leadership, and then you move your way up. So if you're not at a place where you're sponsoring women for these types of roles as co-investigators or multiple principal investigators or co-principal investigators, then it's really hard to be able to do that on your own. So I think that advocating for visibility for women in those spaces who are making those decisions when these larger funding opportunities arise is also incredibly important.
I love that. I have something to say, but if you have something to
No,
say, you go ahead.
I'll say it after you.
Yeah, I was just wanted to bring up, I think you all are making, one of the things, a distinction folks make is a distinction between a mentor and a sponsor. And I think that's always good to keep in mind. I loved your advice that you need multiple mentors. You shouldn't think one person can mentor you in everything. I also think we often think mentors can be sponsors, and one of the distinctions is a sponsor is typically someone with more power, quite honestly, and they're in rooms that you can't be in. And when you're not in the room, this person's got you. They're the one that is making sure your name is said. They're the one that is pulling for you and doing the level best for you to get chosen. And so I think as a woman who works primarily in sports and before that in government, I've had plenty of female mentors. Because of the kind of traditional power structures, I have had to have multiple male sponsors, right? And so in this position, former NFL Commissioner Paul Tagliabue was my first boss, right? And like from a sponsor standpoint, I was like, I'm good money, because he's in all the rooms. He didn't even have to be in the room. He could just call and be like, why isn't Diane in the room? And then all of a sudden, Diane was in the room. And so I just want to make that distinction between mentors and sponsors, and we need both. We're running out of time, but I would love for everyone to finish. One, feel free to give any thoughts that you would like, but two, I think it would be great if folks could share what do you think has been, whether it's a mentorship program, a sponsor, a structural change, what is something that you've seen in your career that has actually been beneficial to your advancement?
And can I add one thing? And if I don't know if you're a 5 or a 2 or whatever, you can add that in because that's where we started. But also, is there a motto? Is there something, a one-line tagline that you wish to leave with people? With people, what gets you up in the morning? What gets you going? What motivates you? So go ahead.
Oh, me? I'll start with my. Is the mic on? Oh, I'll start with my motto, I guess, and this is from my grandmother. So, never put off till tomorrow what you could do today. What has been pivotal for me has been being self-aware, which came through my not being afraid to complete 3, maybe 4 360 evaluations, and that's a tool that was disseminated to different individuals across downstate who I interact with, all right? Because typically how you see yourself may not be how you're being perceived by others. And that was transformative for me.
Thank you. Thank you.
I think my motto would be, what doesn't break you makes you stronger. I think many times during my journey in healthcare and leadership, I went through many instances where I felt very vulnerable and about to break, and I had to tell myself, you just need to, survive this phase. And once you survive it, you are in fact growing and, becoming stronger. And the last thought I want to leave the audience with, we are in a culture that believes in evidence-based practice. We believe in that ethnic concordance, brings out better outcomes in healthcare, right? I don't understand why we cannot match, this phenomenon in representation for women in leadership, right? 70% of women in healthcare, right? That's the task force statistic. Why aren't we represented in that same ratio in leadership? So applying that phenomenon, is evident. There's a plethora of research to say that representation, concordance, works. We need to apply it.
I guess my motto would be, to just, I always say, you got this. When you start having those doubts creeping in or you start questioning your ability, just take a step back and say, you got this, you can do this. And I think take-home message, I think what was said earlier is key. Recognizing leadership skills in people at all levels, not just at the top. And when you recognize sort of that, quality, you want to nurture that, you want to build on that, you want to lend your words of wisdom to someone who maybe, you see yourself from, early on, but providing people with just some guidance, some you've been there, just some tools to help them, maneuver and make their way. I think, not thinking things formally, but really trying to nurture the best that people can be at all different levels, so that those that we come across.
Yeah, I guess my motto would be don't be afraid to disrupt the system. So I believe I have practiced that in the work that I do in my profession, but I don't want to. I want to further underscore the importance of creating formal spaces for mentorship and for exchanging ideas so that we can learn from each other. And so I'm going to shout out to Dean Allen. I'd love to take that further or help you coordinate that or continue that or expand it. Because I think for me, that's what I was a postdoc at University of California, San Francisco, and they had a very robust mentoring system. And from a research standpoint, they are the gold standard in the sense that creating formal spaces where junior scholars can meet, understand ideas, and get structured feedback from mentorship. So I think that's, for some reason, it is missing here. I feel like we need to do more of that. And that recognizing that it is a competitive space, and maybe that's why I wanted to address what Shushawna said earlier. There's only so much we as female mentors can do, and so we have to say no sometimes because we have other areas that we have to prioritize in our professional roles, I guess. And so, I feel guilty sometimes having to deny other people or other students because I just don't have the time. Mm-hmm. And so again, I'm going to go back to creating formal spaces to do that. And I want to recognize that, maybe not all mentors are going to be your female mentors. I guess the biggest role model for me, or I guess sponsor, was a male as well. And he continues, he's a major sort of NIH leader, and he continues to invite me to be co-authors on papers. And it's just that kind of consideration. Even though I haven't been present in the earlier meetings, he'll reach out because it's a theory that we both worked on together when I was a postdoc. And so he'll continue to invite me to those papers. So those little things, especially if you have such a prominent role in the public health landscape, mean a lot. And so, so recognize that, I think it's a competitive space for women. And so we have to recognize that sometimes you have to be a disruptor, figure out another system or that will provide you with the model or the roadmap to get to where you want to go.
I see a few of my mentors in the room, and I also see some of my mentees. So to me, that speaks volumes on how important mentorship is in growth. But I am going to end on a motto that I believe I said this morning, but we need to celebrate women loudly and proudly, and we need to critique and criticize them quietly and appropriately. And so let's continue to recognize each other and lift each other up, and that's where I'll end that today.
That's great. I will also say that I think, making sure you take the opportunities that you're given. Sometimes, and we talked about, the imposter syndrome, you don't really see that you're fit and you wonder why they chose you. And I will say the Dean of the College of Medicine, Dean Chuck Buonicardi is here. And I can tell you when he asked me to be the interim chair coming from GME, I thought he was crazy. But he kept saying, and he pushed it into me for months, I think you can do this. I think that, I will mentor you through this. I think that you are the leader that they need. And he's not only done it for me. If you look at the amount of female and or minority chairs that he has appointed in his tenure, he should be congratulated for that. Absolutely. And so taking the opportunities that are in front of you, even if you can't see it, knowing that others see it in you, I think is absolutely essential. And I will say that my motto is once you get there, look behind you and pull others up. It is absolutely essential that you then become the mentor to others, to pull them up onto your team, to mentor them just as someone mentored you, to sponsor them just as others sponsored you, whether it's male, female, but make sure you count the amount of women that are on your team. And if you're seeing that it's out of proportion, fix it. You know, the amount of minorities that are on your team, if it's out of proportion, fix it. Or because you want to create teams that were not like the teams that you entered, right? You should make it better when you get there. And so it's really important that we pull others up once we get there.
Yeah, I think that these are all really great points. I think to Teresa's point, I have two models that I guess I would that I would mention. One is one that I sort of used for myself when I start to feel occasionally that self-doubt or those sort of thoughts creeping in. I'm a sports aficionado as well, and so Wayne Gretzky, the great one, said that you miss 100% of the shots that you never take. And so making sure that you are interested in if you're thinking about it, shoot your shot. It's just that simple. And the second one, I think, is more sort of external, but I think in really thinking about leadership and the legacy, you know, that we want to leave, you know, as we're in these roles, and then as we transition beyond these roles. I'm a member of the Albert Schweitzer Fellowship, and so, you know, a person who really exemplified living a life of service. And so one of their philosophies is that your life is your argument, and that example is not the main thing in influencing others, it's the only thing. And so when you want to lead, you lead by example, and you think about, you know, with intentionality and clarity, the legacy and the life that you want to leave behind in your life. So.
Thank you. I have one thing, and then actually we have time for questions. So I have a few mottos. One is, jobs come and go, family is forever. If you have to leave to do something for your family, that comes first, and hopefully this institution understands that, because you will never get that time back. And then you were quoting Wayne Gretzky, so I want to quote, I usually quote Maya Angelou, but I'm going to go with Shirley Chisholm, a Brooklyn woman who said, if they don't have a seat for you at the table, bring a folding chair. And subsequently, someone said, if you don't have a seat at the table, you're on the menu. Yeah, so make sure you're at the table. When you go into a meeting, take that seat and own that. And to you ladies, I would say, you own what you've done. You're up here talking to others. This is great. This is a great first step. And you are extraordinary women, and I hope you know that and appreciate that. And with that, Diane, I'm told we have time for questions and answers.
Awesome.
Anybody in the audience have any questions?
So, ladies of distinction, I have a dilemma. For most of my professional life, I've heard women are undervalued, and as you stated with the data today, 70% versus 25% show up. Can you help me understand then, why do I hear women of power say, you know, I hate working for that woman, I hate working for other women. They don't bring me along, they don't bring anybody along. Can you help me with that dilemma as a guy?
Okay, would one of you like to answer it? I thought in Dr. Smith's comments, she began to address what...
Mr. Bennett, I think that, you know, for such a long time, it was crabs in a barrel, or crabs in a bucket, where there were only going to be one or two of us to get to that role. So it'd rather be me than you, right? So everybody was fighting for such minimal positions that I do often think that women felt that other women were a threat. And so I think we need to, as I said before, it's a systems issue that we really need to knock down. There's not just one place for one woman to sit on a C-suite or in the committee. There can be many of us. And with that thinking, we need to realize that we should be bringing others up with us. And so I think it's a historical thing. I do not think that, especially I know in the teams that I lead, that I try to, you know, bring other women or minorities up with me. And so I think, at least, you know, we were talking about the generational gap, and I might be a little bit of a different generation, but in my generation, I think that we're trying to break that. And we're not trying to be crabs in a bucket, you know, and you know, we're crabs linked together. We come the more than one. So we're a bundle. But I think that's historically where that comes from.
Thank you for, you know, giving me the time. As a woman, as a foreigner, and in a sari, I'm very proud to say that we all can succeed, be paid forward, and be the wind beneath the wings of our, you know, sisters. Yes, we need the men, and to teach them that every man should have a daughter,
Only then they realize how precious their girls are and that there isn't equity in the world, and they will change it. So yes, along with the women, we need to educate the men.
Thank you.
Thank you very much. Anyone else have a question?
Hi guys, my name is Dr. Adeboye Jumbo, also from School of Health Profession and Medical Informatics program. Well, I wanted to add, not a question per se, but as an instructor, I think it also goes down to understanding that the students look up to us. The reason why I say this is because a couple of years ago, a couple of students in my class, female, they were very, oh my God, negative. But I tried as much as possible to be professional, which we are supposed to be. But recently, surprisingly, one of these individuals that was very negative now reached out to me on LinkedIn, very friendly, thanking me for everything that, I taught her. The career path, the advices, being patient, because as an instructor, you definitely have to be patient. And I've learned that a long time now. I've also learned a long time, like I think most of you said, speak out. I'm sure at the School of Health Profession, they know by now. I just say, hello, my hands up, I have a question. I think that's the only way that we women can actually showcase that we can do the job. So I just wanted to add that.
Thank you.
What is the next step? Because, as we talk about mentorship and sponsorship, but everyone knows here we tend to work in silos and people are not aware of how they can collaborate with others. So what is the next step that we need to do to move this conversation forward?
Actually, let me jump in a little bit there. So this is beginning of so many things. We are really looking to ramp up the conversations that we've been having, and these are some of the most amazing women I've worked with. Last year, I think we did a series for Women's History Month. We did a conversation on women in research, women in science and research. I keep going back to the same folks because they're always ready for us to be able to do something, and that's what we look for. And in my role as communications and marketing head, we're always looking for people to share stories. We don't know unless you tell us. So I had the opportunity yesterday of meeting this beautiful young lady here who is an up-and-coming researcher. And thank you, Arlene. Arlene yanked her in and said, listen, we're having this event tomorrow. Please come. And she's here today. But there's so many things that are happening here that we're not aware of. And to Adeline's point, yes, many of us are used to working in silos. The Office of Communications and Marketing is open for you. Please, and also please read our emails. They come from Downstate. So many of you have said, I didn't know this was happening, but we've been sending out the emails. We really, really would like you to read our emails. Tell us what you're interested in. And when you have information to share about grant research or capacity building events, please let us know. We're happy to share that. We don't know and we can't get the information to you unless we have it. So let's try to break down some of those silos. And specifically to your question, Adeline, we're going to be looking at bringing some other folks along the way and figuring out what that mentorship conversation looks like beyond this table and beyond the time that we've spent here today. So let's make sure that we're all supporting each other. And from the perspective of mentoring, bring somebody along with you. I have been blessed with mentors at every level. I have mentors at every level, every gender, everything, every age. There's not something that I don't make it a practice to learn every day, and never be afraid to pick up the phone and ask a question. The only way you can do so is by just picking it up and asking the question. I think I'm drawing a blank on the organization, but their motto is trouble the waters, heal the world. And when you dip your finger into a pond, you see the ripples. You see how the ripples go out? That is your role. And that's the role we should all take on as we're struggling to find our way. But let's make sure that we're not doing it alone, okay? Right. I'm sorry.
I would add, I think it's important to add an institutional response. And so I feel like we have a lot of institutional leaders in the room. And, two things I would just remind us that lead, because I lead an organization, if it matters to you, you measure it. And so you need to be thinking about, if you're a leader, if you're leading a department, if you're leading an office, what are you measuring if this matters to you? And the second thing is, if you want something to happen, you absolutely know who manages it. And so if this matters to you, there should be clarity among the leaders about who manages it. And so I want everybody to step up, and I believe in self-determination and making it happen. But institutionally, if it matters, you measure it. And if you really want to know if it happens, you're very clear on who manages it. Dawn may never invite me back again. Thank you so much.
Here.
Are we good, Dawn?
Right.
Yes.
Have
Good
another
afternoon, because I was about to say good evening. My name is Alicia Goodrich. I run government community relations, office mate to Dawn and her awesome team. And I've been here 3 years. I'm the baby. Even though Dr. Valiant said, no, you've been here long enough. It's a year, you're in. No, I'm a baby. And what I will agree is there are silos. But I've been meeting some awesome folks that I'm working with. This woman, Danvy, just forced me to give my flight information. You need to go on a vacation. That's what networking and working together. We're in 2 different departments, but we're doing a lot of work. Same thing with Dr. Afable. Same thing with Shay. There are conversations that we have to have. Literally, in the middle of this awesome panel, I sent Dawn and Arlene a text, what's next? Because we can't just have this. It's got to be more than once a month, because we're giving babies, having babies every day. So our work never stops. It's not just in March we're having babies, right? So our work continues. I will say this gentleman asked for the name of the books. So he is really invested in us. So you're going to be one of our male mentors, along with Dr. Lewis, on how to mentor women in business. No, seriously, we have to put people up, give them the pressure that we need to move on, and that we are really supported. So whatever that looks like, I'm challenging everyone here. You are leaders, you're busy, but we have to continue the discussion. It cannot stop here. I get so tired of the relationships. And someone said that, what's next? Because it can't just be this panel discussion. And we have resources, even if we don't have the money, which we are working on, right? What does that look like? Even if it's online, we don't have the time to come together and put this awesome event. But we have Zoom, we have Teams, we have check-ins. That's what we have to do. If we do it by department, by leadership level, this is why we're doing what we're doing. So hold each other accountable, and also we have to lead our students. I walk up to students all the time, how are you? What's next? When's graduation? Let me know if you need me. I said it to a young lady this week, and she looked at me like, okay. I said, and she didn't know what to do with that. So I said, here's my information. Scan it, because I have Blink. Here's my card. Let's talk. I don't do anything she does. She's in PTOT. But the idea is we have access to the community. We have information to share. We can't be closed-minded and closed thoughts. Our representation matters, ladies, in this building and when we walk outside. Also, we have to make each other accountable. End of the day, thank you for coming up. There was so much more I know you all could say, but now hearing your stories, we have to push the button. We have to push it further, because right now we are in a place of importance. Understand the gift of Downstate and how important it is, where we are, what we represent as a public facility and hospital. We have the space, let's use it.
We have another question over here.
Oh, and if you have this, if you can't be at the table, bring the table. That's the other end of the quote.
Right.
Yeah. Forget the chair.
Going back to the silo conversation again, I want to say that as students, it's noticeable as well. And I will say that for me personally, it has been a point of frustration. Like even, for example, when we had the Downstate closure issue, there was complete silence. There was no interdepartmental conversation happening that at least we were a part of. And on my part, for example, I was pushing to hear, okay, what are we doing? Is there something that's happening? Is there someone that we can talk to? And so I find that on the institutional level, it's missing, but also within our departments, maybe there is more that can be had in terms of conversations regarding that. Like even, for example, with the public health program, it feels like we are kind of like the stepchild of the institution. And I think that there is work to be done there because, for example, Downstate is a healthcare institution that has a healthcare administration program and a public health, master public health program. But what kind of pathway, for example, do we have institutionally where students can come in and, for example, shadow leaders who are working here at our institution, who are showing us what their struggles are, what their successes are, what can we take from that, and what can we bring back into our classrooms. And so I think starting there would be really helpful, especially like even, for example, among students, we don't know each other. I know some people from the other programs because I have come on campus to participate in advocacy actions and so forth, but we don't really have as much of that happening as we could in other spaces. And also going back to the communications emails, I mean, I think maybe how we communicate as well can be expanded. Like the emails are great, but we're getting lots of emails from everywhere. So, I mean, maybe there are other tools that we need to take in terms of, like, for example, like when there are special events happening, like maybe they come out on Fridays only, and you know, okay, look out for this event list that's happening, or in the email title, like we're just saying event, so you know, okay, it's about events. And because I think Downstate, because it's so small, it has all these great opportunities, but often students don't know that they're happening or where to go for them. And I think being able to have that streamlined would really improve, especially since we're dealing primarily with marginalized populations. It would make a great difference in our pathways.
I understand. I get as equally frustrated as you are. From a communications perspective, we work as best as we can with the information that we've been given. And sometimes, unfortunately, we're unable to speak to certain things given all of the political things that we're dealing with now. So I ask you for some patience on that and some grace and understanding with that. It's a very delicate conversation for us, as I'm sure you understand. So we have to sort of tread very lightly. But in terms of communication, unfortunately, there are lots of emails, but we do ask you also to follow us on social media. If you're not following us on social media, you miss a lot as well. We do as much as we get when we get the information. Sometimes we don't get it, unfortunately, until the absolute last minute, and then I'm yelling at my team to get something out overnight, and they're really good. Thank you. My team is always great. Thank you, guys. And we could not do the work that we do if I didn't have the team that I do, so I'm always appreciative of them. But we need your help as well. And unfortunately, we don't get information the way that we need to get it often enough. So I need your help in order for that to come to us. So the more that we have, the more we can get out to you and more expeditiously we can do so. But also, please give us enough lead time. Sometimes we get something the day before and say, put it out. It doesn't necessarily work for everybody, but we do our best. So for everyone who is really concerned, please remember, look at your emails. Please share your emails. You know, we have an email address that comes back to our box. We check that box several times a day. If you've got suggestions, we're happy to listen to what you're suggesting. If we're able to do it, we will certainly do our best to make it happen. Can't promise because I can't promise, but I certainly will always look at what we can do. And again, with the team that I have, we're always looking for ways to make things better for everyone else. Thank you for your question.
I do just want to short in the time because we're talking about engagement and university-wide events. There's two really great events that are happening this week. The first one is the interprofessional case study, which is being hosted by the School of Health Professions, but is in partnership with the School of Public Health as well as the College of Nursing. And so that is a student-centered event that is happening on campus as well as virtually. So that would be a really great opportunity for students to get involved. We are looking still, I'm sure that we would be happy to include more students, so anybody who's interested in that would definitely be able to participate, and that's a great example to have mentorship and access to faculty as well from all of the different institutions. And then the last one is this Friday, our Transport Symposium, which is our Community Engaged Symposium, which not only has faculty, but community-based organizations and governmental leaders and students. And so that is another event that is happening this Friday that would be a fantastic opportunity. So whenever these events arise, we want to make sure that we are elevating them and encouraging folks to be able to get involved as they're able. So just wanted to highlight two more that are happening this week.
Thank you.
Wait.
Over here.
One over here.
I'm always going the wrong way.
Hi, I'm Joanne Katz. I'm chair of physical therapy. I've been at Downstate now for 30 years. I wanted to address the issue about working in silos and, you know, what else can we do after today? And I think one important thing that we can do, because so many of us are researchers or would like to spend more time doing research, is to have more interprofessional research. Because you have a lot of academicians on the academic side. You have a lot of clinicians on the clinical side. The clinicians have access to patients that the academicians don't. And being able to collaborate with people would be a great thing. We've done this in the past, and I'd like to see more of it, where there's some kind of a list and everybody puts into it, anybody who wants to work with others puts into it what their area of research is, what their area of interest is, so we could get people together. I'm a pediatric physical therapist. I worked for many years with the Department of Pediatrics, with neonatology. I and Dr. Perenni worked for many years, and we also worked with a basic science researcher, and that's how I'm able to have a nice grant on my CV, because the basic science researcher wanted to pursue this, and we pulled together everything in terms of pediatric physical therapy, neonatology, basic science research, and I think we need to, you know, our strength is ourselves, as we mentioned before many times. You know, you see that evidenced by all of these strong leaders on this panel today. So I really think that going forward, I'd like to see more interprofessional and interdepartmental collaborations with regard to research, and more research being produced by this university resulting from those collaborations. Thank you.
And Joanne, to your point, that's one of the goals of the research capacity meeting. So come on out. It's the third Wednesday, Alan, of second Wednesday of every month.
Hello, good afternoon.
12
everyone.
o'clock via Zoom.
Hello, good afternoon, everyone, and thank you to the platform for this great conversation, because I think it is important for us to continue to have these conversations. I have been on both sides of, especially what the doctor said over there, that women in healthcare, we are about 70%, and at times we do not feel supported by other women, or we do not want to work with other women who's in a leadership position due to their, I guess, their styles or the way they deal with other people. I have been traumatized by some of those individuals that I had to take a step back and be like, and if I was ever to be interviewed for a position, I would ask, is it a woman or is it an African American? So I would choose, and I remember one time I did turn down a position because of that. So I think we do have a long way to go when it comes to that. I've been here for maybe 6 months, and I think it does have something to do with the institution, with the leadership that has to send the message, or it has to be brought down later on. And being here, I met Alicia. She's just great. I didn't know who she was, and it was just to an event that I met her, and every time she sees me, she's like, yes, this is Shirley, and you know, she introduced me to people, and she feels welcoming and warm. And then I met Juliet and Kino, and then being within the Department of GME, we have the coordinator platform that we support each other. It doesn't matter who you are or what. I think every department needs to have that type of collaboration to make people feel supported, to make you feel that you want it, that you love and enjoy the work that you do, because we have to think about each other's morale and emotions. We're all different, so we have to learn to support and appreciate and mentor and teach, and not feel that the next woman next to you is your competitor, that we have to do and be in that cutthroat that if I teach you what I do, that's with the thing. If I teach you what I do, you become a threat to me, that you're going to take my job. We have to stop seeing each other as a threat. Instead, build each other up. Thank you.
Thank you. Thank you. Thank you, everybody, for coming out for today's panel discussion. And really, I appreciate the time that you have taken to be a part of the conversation, to be a part of our audience, to be a part of our online audience. So for the next couple of months, we're going to be doing a couple of things. Not 100% certain yet, but I'm working on something for Pride Month. And I'm also working on something for June, National Men's Health Month. So please keep an eye out for what's happening. If you're interested in volunteering in any capacity, please reach out. My staff would be very happy about that. But we're always looking for other input. We're also looking for ideas for anyone who wants to be a part of a panel. You find it, you give it to me, I will find a way to make it work. That's what we do. So thank you all so much for coming out today. I really appreciate it. Thank you for being a part of Downstate and for making Downstate a really great place. You've been here 7 years, and there's a running joke with me. I've never been any place longer than 3 years. I've been here 7 years. I love this place. I grew up 10 minutes from here. This is my community. I love this place. I love the work that we do. I know what we stand for. And I know that you're all here because you're equally as committed as I am. So thank you for that. Have a great day, everybody.